Hello and welcome to the College of Health Professions School of Pharmacy discussion regarding this major. So what is a pharmacist? How many of you have walked into a Target or a Walgreens and you've seen the people behind the counter with their white coat on? Or you've been in a hospital or clinic and you've had a pharmacist come into your room to talk about the medications that you are currently taking or to adjust dosages to help you feel better. Those are a pharmacist. They're an important medical worker who dispenses appropriate medications for their patients. Some of the pharmacists may specialize also in pharmaceutical research, education, marketing, or sales of a particular medication. So it's not just, a pharmacist isn't just standing behind the pharmacy counter in their white coat. There's many different avenues that they could take. They can also work in the drug companies, they can work in retail stores, they can work in hospitals, they can be in the military, they can work in large veterinary clinics, they can work in academics. There's so many different options for pharmacists. They are specialists in their knowledge of medications and must always be furthering their education as medications are constantly developing, evolving, and changing. So, what does the pharmacist do? We talked about it a little bit in the slide before, but here's a general overview of the many different things a pharmacist will do. They're taking a look at the quality of the medication supplied to the patients, ensuring that the medicines are within the law. They're making sure that the medicines prescribed to a patient are suitable for that patient, that there aren't any drug interactions between the different medications. And they're also advising the patient on how they should take them, what reactions may occur, and answering any questions that the patient may have. Pharmacists also supervise the supply chain, and they make sure that all of the meds are secure in their storage. They advise other healthcare professionals on the safe and effective use for the medications. They work on services for the patient, such as smoking cessation, blood pressure management, and cholesterol management. There are many different settings that the pharmacist can work in. Again, it's not just the retail pharmacist behind the counter at your local CVS. There are many different options for a pharmacist nowadays. At NDSU, we have two different pre-pharmacy program tracks. The pharmacy program, first of all, is a doctorate degree. So it is the Doctor of Pharmacy or the PharmD. And so it's not just a bachelor's degree. For pharmacy, you are looking at 2 or 3 years pre-professional and then 4 years in the professional program, again, earning a bachelor's degree at the end of your second year of the professional program, or we call it P2 year, and then your doctorate of pharmacy at the end of your 4th year in the professional program. So again, for pharmacy, we have 2 tracks. We have our early admission pathway, which is a 2-year track, and our traditional pharmacy track, which is a 3-year track. If 4 years in the professional program, 2 or 3 in the pre-pharmacy track is not enough for you and you want to be at NDSU for longer, we can certainly help you with that as well. We have dual degrees such as your PharmD and your business, your Master's in Business Administration. You can get your PharmD and your PhD. You can get a PharmD and your Master's degree in Public Health. There's many different options. So some traits that we find most commonly in pharmacy students. You have to have a very strong interest in and ability in the sciences and math. Pharmacy is very chemistry heavy, so if chemistry is not for you, then pharmacy probably will not be something that you enjoy. So definitely have to have a strong ability in the sciences, a little bit in the math, not as heavy as, say, like engineering. You have to be very detail oriented. Again, you're giving medications and you have many, many different options for medications. You have to make sure that the medications that you're giving to your patients are the correct ones, the correct dosage, the correct number of pills given, or whatever, if it's a solution, whatever that may be. Very detail oriented. Good at problem solving. Again, you're working generally in a medical setting, so you need to be compassionate and have good communication skills. And then you also need to be able to work independently and with team members and in stressful situations. Some of the classes that are found in the pharmacy curriculum include general chemistries 1 and 2, organic chemistries 1 and 2, and biochemistry 1 and 2. We also have general biology 1 and 2, anatomy and physiology 1 and 2, and microbiology. You'll find some math, which include applied calculus, physics, and statistics. And then we have other classes like our CHP 190, which is our critical thinking and academic success class, and some of the gen eds, such as English 2, public speaking, microeconomics, some of those classes. So the demand for the graduates, for pharmacy graduates, you can see on the slide, it's definitely anything in healthcare at this point is expanding. In one of the other presentations I did, healthcare jobs are expanding much more so than any other field right now. They're expecting to add approximately 2.4 million jobs within healthcare in the next 10 years, which is a very, very high number. The average salary for pharmacists, again, you're starting out with a doctorate degree, so it's not a bachelor's degree. The average salary is about $120,000. Again, it depends on if you're in a rural or urban setting, whether you're in North Dakota versus Texas or California. But that's about where you should expect to start. And if you have any questions regarding pharmacy at all, please feel free to contact me. Again, I'm Kelly. I'm the advisor for both pharmacy and health services. You can find my email at the bottom of this slide. And again, I did not put my office number. I'm located in Sudrow Hall, but our offices are currently being moved. So once I have my new office number and my new office up and going, then we can certainly meet there as well. But feel free to email me or give me a call. Thank you.